So, first of all, I'll introduce myself. So, I'm Alisha. I'm the PIRIT Implementation and Dissemination Lead, and I work at Cardiff University. And I'm going to talk to you today about the PIRIT approach to planning for tracking and demonstrating public involvement impact. This was a partnership project between the Marie Curie Research Centre and the Wales Cancer Research Centre. I'll tell you a bit more about that in a moment. Thanks very much to Health and Care Research Wales for inviting me to speak today, and of course to all of you that have joined the session. Ordinarily, there would be one or more than one public member co-presenting with me today. But there's been quite a lot of demand actually, and the team have been presenting quite a lot to various teams and centres. So I'm afraid you've drawn the short straw and just have me. So hopefully it'll go well. So today in the session, I'm going to talk a bit about the development context and approach for the PIRIT toolkit. Talk a little bit about the current context and some of the planning pitfalls that I've recognised and how the PIRIT tool can help with that. I'm going to give you an overview of both the planning tool and the tracking tool, talk a little about the uptake and utility of PIRIT, and then there should be a good amount of time for questions. As Claire said, we've had over 150 people sign up today, including public members, staff from a range of sectors within and outside the UK. Some of you might be familiar with PIRIT and have given it a go already, and some may not. So I've tried to take that into account in the session. Hopefully I've achieved that. So to start off with, this is some really a powerful reminder really of why the public get involved in research. These words are from a public contributor who got involved in research after losing their spouse to a brain tumour. And they said, I keep saying this to all the people who will listen to me, but the perspective that we have sadly in many ways is actually seeing this disease unravel 24/7. Using your words, has got to steer the way that we take this research. And really, that's just a reminder that, the public get involved because they want to make a positive difference to research. And they do that because they want better treatments, services and experiences for people. When we're talking about impact today, we're talking about impact of the public on the research itself. So just to be clear on that. So just a bit about the development context. So as I said, this was a partnership project. It started way back in 2020, that dreaded year, towards the end of 2020, when everybody was at home isolating and so forth. The partnership was between the Marie Curie Research Centre and the Wales Cancer Research Centre. So the Marie Curie Centre aims to improve the care and experiences of people with a range of life-limiting illnesses and their carers. And the Wales Cancer Research Centre aims to improve outcomes for cancer patients from early diagnosis through treatment to survivorship and end-of-life care. And as you can imagine, all of those research areas, it spans a wide range of topics and methodologies and approaches to research. But both organisations have really embedded public involvement in their culture and practice. We involve the public at strategic level and in research projects. This particular team that worked on this project together, there were 4 public members, one of whom had developed the UK's had been involved in the development of the UK standards for public involvement, and the other 3 had used them and or helped pilot them. And then there were 2 researchers. So there was myself, I was the academic lead for public involvement in the Wales Cancer Research Centre at the time, and Professor Nelson, who was the previous academic lead. So when we're talking about public involvement today, I mean, terms differ depending by the organisation you work in, the sector, the research field and the country. And we've got a really huge mix of people here today. You know, some people will call influence on decision making public involvement, other people will call it engagement. You know, others in epidemiology, psychology might call it participatory research. If you're working in the youth and community sector, you might call it participation. But whatever you call it, it basically boils down to the influence on decision making. And this is all caught up and intertwined with concepts of power empowerment and the moral and ethical reasons why people should be involved in the decisions that affect them. We know that doing this enhances research and services. It makes it more acceptable. It enhances the reach. And we also know that it's expected by funders and regulators. So, as I was saying, back in 2020, the team were looking at the UK standards. They had been launched the year before. And we were looking at how can we practically implement these. So one of the standards, the impact standard, talks about the need to seek improvement by identifying and sharing the difference that public involvement makes to the research. And really, we were looking at how on earth do you translate these fabulous principles into practice? How do you operationalize these? How can we integrate the standards into what we're doing day by day so that we can meaningfully involve the public and capture and demonstrate the difference that their involvement makes. And really, we were looking for a really pragmatic framework that supported impact from planning right through to reporting, and something that sort of, I guess, followed the study pathway, because it's great to have these set of principles, but how do you turn that ideology into action? And that's what we were looking at. When we looked at existing tools, and there were some great ones out there, some were quite involved or focused on specific aspects of involvement and impact. Others were reflective, but none were directly linked to the standards. So as I said, we were looking to develop something or find something that was pragmatic and also took into account the practical constraints that researchers and public members face. So, as a team, we discussed this and we came up with 5 key questions. And these were: how do we efficiently and consistently approach public involvement planning? And you'll remember we're talking about a huge array of research. How can we do this across all of it? How can we easily communicate planned activity? How can we identify which UK standards we'll be working to, capture public contributions, the difference they make, and report involvement in activity and the impact against the UK standards? So this turned into, it's been quite a long journey really, but a piece of work to develop 2 pragmatic tools to help you to plan and integrate public involvement in research, track public contributions and the difference they make, and report impact against the UK standards for public involvement. So originally we set out to develop something for in-house use at the Marie Curie Research Centre and the Wales Cancer Research Centre. But we did take a very kind of open and engaging approach, and we talked to anybody that would speak to us really, that was interested in public involvement and the standards and impact. And we soon realised that particularly impact was a real topic of conversation at the time. Health and Care Research Wales had identifying the impact as public involvement as one of their objectives. So did the National Institute for Health and Care Research. So we spoke to them, they helped us put webinars on, and we quickly realised that we needed to make this open to the public. So we tested it in-house with 3 Cardiff University research teams. And I'm pleased to say that it's now free for users under certain conditions that I'll discuss later. So just in terms of bringing it up to speed, we're 4 years on from where we started, and really we are in a time of change. I think the research and public involvement are becoming more and more intertwined. research is becoming more people-centered. There's a huge focus now on inclusivity, and any of you that went to the webinar by NIHR a few weeks ago will know that in future they will expect us to describe inclusivity measures in every part of an application. And really, I think we're at a time where we're action orientated now. It's not all about just talking, it's about doing, it's about making the changes we need. What impact this is going to have on public involvement, I'm not sure. That remains to be seen, but I expect there will definitely be a greater focus and scrutiny on who's involved and how, and also, are we equipped to involve the public well? So linked to that is, are we equipped to involve the public well? I am lucky enough to work with researchers, many researchers, and I'm privileged to do so. And they often ask me to review and comment on grant applications and support them to develop their public involvement plans. This is as part of my role at the Centre for Academic Primary Care. And one of the common pitfalls that I notice is that we have a tendency to under-resource public involvement. And what I mean by that is people are costing in meetings rather than meaningful involvement. And often this is because time is short and people are scrambling to pull an application together. Maybe they're not quite sure of what involvement activity there will be. And basically, coming back to the point that involvement is all about influence on decisions, what we can do is use the PIRIT planning tool to help you link your planning and costing to the key decisions within the research. And I'm just going to go through, show you the planning tool now. So here's a picture of the cover of the planning tool. We designed it to be used from inception of the research idea. It offers a consistent involvement planning approach. The idea is it's co-owned by research and public contributors. Really, it's a discussion tool to help you to identify potential public involvement activities. It encourages a collaborative and transparent approach, and the items that you identify can be used in proposals, in role descriptions and protocols. It can help you to cost your public involvement. It can be used as a reflective tool, and it can be used alone or in conjunction with the tracking tool and other public involvement tools. So this is what it looks like. As you can see, it's like a menu of activities, and they're guided by the UK standards. The little cubes there, really, these are your building blocks for impact, because if you involve the public in the right things and support them in the right way, you're more likely to for their involvement to be impactful, because you'll have an environment that will support and sustain it. So what you do as a team is you would go through this document, discussing the items, and then as you go, you highlight the items that you want to choose. The ones you choose will depend on what's appropriate to the project and study. It will depend on the available resources, the interests and skills of the involved public also. And you can see here that they're the little yellow rings there. You can see here we've gone through and we've tried to link them back to the UK standards. So we went through all the standards and identified or agreed all the ways we thought the public could help achieve those standards, and that is the content of the planning tool. So this is what it looks like. You can see here that there's a little dot there I popped in about costing and funding public involvement activities. That just harks back to the point I just made. So at the top here, you can see there's evolving the appropriate population. You've got the difference that the public contributors make to the research question and design, the difference they make to the conduct of the research, coordination and documentation, the difference they make to the outcomes and dissemination of results, the implementation of findings. And then section 7 and 8 are more about kind of reflection and debriefing and looking at your public involvement practice and what's worked, what could be better, and what was the impact of the involvement. So I'm going to go on now to show you the tracking tool. So the tracking tool, again, this is designed to be a co-owned record kept by the involved public and key staff. The idea, again, is that it aids dialogue and transparency. It is really focused on capturing the essential data or information so that recording and reporting on impact is a proportionate task, because these things can, become monsters if you let them. The idea is it's kept as a live document, so it's updated as contributions occur, and this supports real-time reporting for a variety of uses, for funders, for your division or department, and so on. And it also supports reflection and learning. So it is a spreadsheet, and we recognise that not everyone is willing or able to complete a spreadsheet. We suggest that researchers take the lead on entering the information into the spreadsheet, and how you get the information is down to what is appropriate to the people you're working with. So, but the spreadsheet is separated into two parts. There's the involvement activity, which is about when and how the public contributed, what they hope to influence, what changed. Not everything, doesn't always lead to a change, and why this matters. And that's really the so what question, what difference has this made? And then the second part is about the involvement standards and identifying and linking it to the standards. Oops, that's the wrong button. Apologies. Right, I'm going to just give you a quick tour of the tracking tool. Sorry. Hopefully you can see this. So as you can see here, as I said, the first part of the tracking tool relates to the involvement activity. And if you file along there, the second part relates to identifying the involvement standards the activity relates to. The tool includes an introduction and purpose. It includes some information about the format and use. It includes some examples here of public contributions and the impact. There's also a tab here that outlines the standards and the reflective questions here. So I'll give you a little demo. So as you can see, it's a really simple example here. So this is the example project. Joni is the public involvement lead. Start and end dates here, and we've got Susie and Leon currently involved in the project. So in this instance, on the 16th of July, at a study management group, Leon reminded attendees that members of the public were present and asked for technical language to be avoided. As you can see, this is a really concise summary. You don't want reams and reams of paper. If you've got a long project, a year, 3, 5 years, this would become a very unwieldy document if you put too much information in. So why did what did the member of the public hope to influence? So here, Leon wanted to ensure that everyone could understand and take part in the discussion. The reason why we ask this question is to make sure that if you as a researcher are inputting this information, that your interpretation of their intentions is correct, that you're not misunderstanding or mishearing. Then we move on to what influence has this had? So here, As a result of this comment, the study management group agreed to simplify the language, explain terms if used, and produce a glossary. So why does this matter? So it matters because it allows people to work together. It means that the communication is inclusive and that all group members can meaningfully participate. They can also contribute to decision making, and it supports learning. So in this example, then you would go along and you would say, well, this is about making the opportunity and conversations accessible. So yes, it does include that the inclusive opportunities standard is applicable here. This example also builds and sustains mutually respectful and productive relationships, so that applies. It builds confidence and skills because of the adaptations and the increased knowledge and understanding that the public and other members are going to have. You might think, oh, is this to do with governance? I'm not sure. You can just put don't know and come back to it if you don't know. It is about communications because it's about use of plain language. And it's not necessarily about impact, although it has an impact. This activity isn't about impact. So, as I said, if you're struggling here, there are amazing reflective questions within the standards, and these can help you identify which relate to the activity. So that's that. We're going to move on. Oh, where are we? There we are. So we did test this, as I said, with 3 Cardiff University research teams. And they said that it formalizes public involvement. And this was a comment from a public contributor. And he said, really, it's kind of made me realize how sort of ad hoc public involvement can be compared to other aspects of research, which was really interesting. They said it serves as a reminder and really encourages you to continuously revisit the standards and get more familiar with them. The planning tool is excellent for mapping planned activity, and it's a way of setting and monitoring objectives, which really appeals to goal-driven teams. It's a good framework to identify impact, practice strengths and improvement areas. And really it does, the tracking tool in particular, provides really rich data for narrative accounts, chapters and quantitative reporting too. I just wanted to quickly show you this. It looks really busy, and that's kind of the point. The COBRA study that has piloted the PIRIT tool. This is a diagram they developed, a timeline really of public involvement activity, and this is derived from the information in the tracking tool. So I just thought you might be interested to see that. So that's what the 2 tools look like and how they work. We launched them in February 2023 at the Marie Curie Research Conference, and there's myself, Kathy, one of the public contributors, and Ellen that actually developed that diagram you just saw, presenting it. As I said earlier, it's a licensed tool, so you can adapt it for your own uses. Really, it's a gift to you now. We've made it freely available under a Creative Commons license, so you can adapt it. As long as you cite the original tool and don't try and make money out of it, then that will comply with the license. So since the launch in 2023, we've had almost 1,500 downloads, over 65 a month. And we've had people from 31 countries download it. We've had a lot of interest from funders and regulators who have signposted to PIRIT, and it's been included in grant calls. There was a big UKRI call recently that specifically mentioned PIRIT, Cancer Research UK, Marie Curie, the Health and Healthcare Research Wales integrated funding scheme call included it as well. So in terms of what's next, the paper is almost finished, I promise. And we're also going to be doing a user feedback survey just after Christmas to get a better understanding of its uptake and utility. There are some adaptations and other uses. It's being adapted for teaching. And there are a few other irons in the fire that I hopefully will be able to share soon. This is the project team and our titles and positions as they were at the time of developing it. And this is where you can download it. And thank you very much for listening.